Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Benny here with us this afternoon. And Benny is suffering from chronic, severe low back pain and leg pain, sciatica, lumbar radiculopathy. Those are all synonymous terms. He was digging with a pickaxe when he was, 18? 18 years old, and hurt his back and herniated the lumbar disc down there at that time. And this comes back and haunts him every so often.
Yes.
And now he's had this most recent bout going on for about 2 months, he says. And he gets like this where he can't stand up straight, and he's all cocked over like you see him right now. Sitting in a chair, he can't even sit in the chair straight. He has to sit sideways just to get comfortable. And I bet you have a hard time sleeping like that too, huh?
Oh my God.
So, and your pain level is pretty high right now, huh?
Yes,
On a
sir.
0 to 10 scale, it's probably 8, 9?
Yes, sir.
Okay. So we're going to show you what the very first visit on a severe chronic lumbar spine herniated disc looks like. So let's have you face the mirror for me first here, Benny. All right, I'm going to have you close your eyes and bend your head forward and then backwards. And then neutral. Yep. Okay, so he's got forward head posture. You can see his ears way out here in front of his shoulders here, and that puts a lot of increased weight bearing all the way down these paraspinal muscles. He's also translated way to the right on the cervical spine, but his pelvis has shifted way left of center. You see in the mirror? You got a lot of room here, hardly any room over here. Do you see that?
Yeah.
See how your head's a little forward and to the right? So that means you got a curve going on in that spine right there. So let's go ahead and have you lay on your back on this table for me, Benny, with your head up this way. I'm going to do some orthopedic neurological tests on him now to evaluate him for herniated disc, and these are very standard orthopedic neurological tests. This is called a straight leg raise test. Did Benny tell me, besides the tightness in your hamstring, if this causes any lower back pain or shooting leg pain? Little low back?
Yeah.
Or leg?
No.
Low back? Okay. Now, does it feel better down here?
Yeah.
Okay. Is there any back pain or leg pain when I do that?
No.
Okay, let's cross this one over here. As I push this down, do you feel any hip pain or back pain?
No, sir.
Okay, good. So this is his good side. He's got the radiculopathy down his left leg. Okay, I'm going to lift this one up. Tell me when it starts hurting.
Right there.
Right there? Okay, so he's got a positive straight leg raise at 40 degrees. Okay, does this make that worse?
No.
When I bring it up?
Right there.
Like that? Okay. So this is a sciatic nerve traction test that shows it's worse. Okay. Does this cause back pain or leg pain when I do that?
A little bit.
Yeah, that's a positive Braggart's test. Okay, let's cross this over. Now, let this flop down. Tell me if this hurts in your hip or your back.
Yeah, my hip.
Okay, deep down in here?
Yeah.
Okay. So he's got all positive tests here. Straight leg raise, Braggart's test, Fabry-Patrick test on the left. So his problem's all on that left side of his sacroiliac joint and lumbosacral joint. I'm going to lift your head up for me. Tell me if this hurts anywhere in your spine when I do this, Benny. Okay. Now, let's set you up and face towards Joseph. I'll help you up sideways. Here we go. Grab onto my hand here. And let me kind of swing you sideways towards Joseph there. There we go. Let me help you up. That's it. See where I get my workout every day, working on guys like Benny. Let's get back this way a little bit, Benny. Tell me if you feel any pain in your spine anywhere when I do this. Okay, now I'm going to go backwards and to the left and down. How about this one? Nothing?
No.
Okay. How about when we go back and to the right and down? Is there any pain there?
No.
Okay. How about when you just tilt your head this way? Is there any pain anywhere?
No.
How about when I do this?
No.
Okay. How about when we go this way? Does that tighten up a little bit more than the other one?
No.
See, it's a lot stiffer this way. Is that a little stiffer on this side?
It's real stiff, but
Yeah.
I don't feel
But you don't feel any pain?
no pain.
Okay. Does this make your spine feel better,
Yeah.
same, or worse? Better, huh?
It's like a little relief.
A little relief.
A little.
Okay, so that's a
Now I feel tingling down.
spinal decompression test there. Okay, I'm going to push down. You hold this up. Excellent. Same thing here. Hold this up. Excellent. Okay. check your reflexes here in a second. See, I'm going to pull out first, test your biceps, hold. Good. Now I'm going to push in, test your triceps. Good. Okay, so we're going to test your biceps first. I'm going to pull out, hold. Good. And then your triceps. Good. Okay. And just relax that right there. So we're going to check his reflex. Just let that hang right in my arm. There you go. Good. That's better. Better on reflexes when you're relaxed. There's that. Good. Okay. Let that just drop. There we go. Perfect. Yes, sir. Good. Oh, there's a problem right there. Okay, now as you can see, he's got a really good patellar reflex here on the left, but not the right. Now it's interesting because he's got more of the pain down in the left side. So let's check his Achilles reflex here. Just let your foot relax. There's nothing there. Let this one relax. And see, we got a little kick on that one. Okay. Now, I just need to see if you can stand up and walk towards me on your tiptoes for a couple steps, Benny. About 3 steps. On tiptoes only, though. And you can wait till you get up. Okay? Now, see, it's really difficult for him just to transition from sitting to stand and come towards me. A couple steps. Okay, this is a toe walk test, and he's having a hard time on that left side keeping it up, aren't you?
Yeah.
Keeping your toes up. Okay, now can you walk on your heels only for about 3 steps this way? Okay, so heel walk test is okay, but it still felt weak on that left side, didn't it?
Yeah,
Comparatively.
a little bit.
Yeah. Okay, so let's have you stand up, face that wall right there for a second. Now, when you bend forward to try to touch the floor, tell me if and when that starts hurting in your lower back or pelvis or your leg.
Right there.
Okay, is it pulling down in your leg already?
Yeah.
Okay, did it hurt coming back up too?
Not that much.
Okay.
Yeah, now it hurts.
Now it does hurt.
Yeah.
Okay, so if you cross your arms out in front of you,
yeah,
and I lean you backwards, does this increase any pain anywhere?
Yeah.
In your leg?
Yeah.
Okay, how about when we go this way and down, does that make it worse or better?
Same.
Okay, how about when we go to the right and down? Then
Oh, it's a little less.
a little less? Okay, that's a Kemp's test, and it's positive on the left. Okay, so let's have you lay on your stomach here then, Benny. I'm going to have you put your face right down this little piece of paper here. And you rest your arms right there. So now you get a rest for a second. Breathe. You get the easy job. All you got to do is breathe. Now you've seen us take care of several really severe lumbar spine pain patients as well as sciatica and radiculopathy patients. Noe being probably our most notable one. As I'm palpating his lumbar spine and the paraspinal muscle, you feel those knots right there?
Yes, sir.
Yeah. He's got these huge knots in his paraspinal muscles on each side that are very palpable. You can even see them moving under my fingers right there. Some on the right side too, but not as bad as the ones on the left.
Yeah.
And I bet you that's probably a little tender right there in your SI joint, and then his sciatic knots right here. Yes, he's having most of his pain down the lateral thigh and into the lateral part of the lower leg, like right in there, tender too, Benny?
Yes.
Okay. So right through here is all tender. That leg pain's following the track of the sciatic nerve. It's also called lumbar or lumbosacral radiculopathy. I want you to lock your right leg straight for me, Benny, and lift your whole right leg off the table. Okay, now relax that one. And do the same thing on this left side. Yeah, that's hard to do over here.
Yeah.
Can't do that one. Okay, so now I know his sacrum is stuck. That's the middle triangular shaped bone in the center of the pelvis. You ready to feel better, Benny?
Yes, sir.
All right. So again, you get the easy part. All you gotta do is breathe. I'll do all the rest of it for you, okay?
Yes, sir.
Alrighty. So we're doing a straight superior to inferior adjustment on his sacrum away from L5. And that was on the left side of the sacrum. Now I'm on the right side of the sacrum. Now I'm right in the center of the sacrum. And now I'm going to adjust his right SI joint here. And then his left SI joint right there. This is probably going to be a little bit tender. There we go. Okay, now I'm going to get at L5 right there. L4. Do that one again. There we go. Now, these will probably be a little bit sore here at first, Benny, but they'll calm down after they relax a little bit. And then you'll feel a lot better when it quits hurting. There we go. Okay. So I'm going to stick my elbow pretty deep down in your quads and your gluteus muscles right now. I'm going to talk about quads, not your anterior quads, quadratus lumborum right here. Right there. There we go. See, I'm betting already that now when I push down here and ask you to lift your left leg up, try it again. Yeah, see, that's already much better, wasn't it? That was easier that time, wasn't it? Yeah, that's a big wow. Better. Okay, now, Benny, I know you're hurting a lot, but I'm going to get my heavy equipment out on you. This is called the Turbonator. It's going to get deep, deep down into your tissues and help break up some of these fibrotic scar adhesions that you've got going on in here.
Okay.
Now, if I plug it in, helps when it's plugged in. Okay, nice deep breath. Okay, you can take a breath now. So I'm sure Benny can tell you that was pretty intense. Legs are even, and does this cause any pain or pressure in your back or leg?
No, sir.
Okay, great. That's negative. I'm going to have you lock your right leg straight and lift this whole right leg off the table for me. Good. Let's do the same thing now on the left side. Much, much better. Period post. So we're going to move up his spine a little bit now. He's not really having a lot of complaints up here, but we're going to adjust the entire spine. Get it ready to be decompressed here in a second. There you go. Just keep breathing normal like that, Benny. That's perfect. Okay. Okay. There it is, right there. You feel that?
Yes, sir.
That was a good deep one. Okay. Yes, sir. Good deal. Okay, now let's have you turn on your back for me, Benny, and we're going to have you come on this table. Actually, you can come over on this table now on your back. And I'm going to have you put your pelvis right here, legs down this way. Okay. Yep, just like that on your back. I'm not going to put you on your side and twist you. I do not recommend putting people on their sides and twisting them when they have herniated discs because it creates more ligamentous instability. I saw those comments today already. Let's slide up this way just a little bit there, Benny. And no, I don't know any chiropractors out in Abilene, Texas, or anybody just like me in New York City or Miami. I do recommend that you go to a Palmer graduate, like my last video talks about, though. That's the closest you're going to find to doing what I do. But I do not twist people's lumbar spine sideways in most cases because it can create ligamentous instability, which is a looseness of the ligaments in the low back and the pelvis. Okay, my friend, so I'm going to have you put your hands on your tummy down there, relax them. I'm going to put this wet towel under your skull, okay? There you go. Now keep your teeth together for me on this one, Benny. I want you to take a deep breath in for me, please, sir. Let all your air out. Okay. Oh, yeah. Woo, baby. That's what I call my ring dinger. Do you feel that all the way down, Benny?
Yes, sir.
Okay, good. See, he is still kicking. Even better now. The right one's still a little bit low compared to the left one, but still moving better. So we have not adjusted his cervical spine yet. Perfect. Nope, I got another one here. Drop it right. My hand wiggy left big toe. There we go. Good. Okay. So I'm not done yet, Benny. I bet that's more adjustments than you've ever had in your life, though.
Yes, sir.
Okay, so now keep in mind, y'all, this is Benny's very first treatment here. There you go. You should have felt that in your knee and your back, Benny, did you?
Yep.
Okay.
Sure did.
Okay, we're going to take the bad leg here now. Keep breathing. There we go. Did you feel that one in your knee and your back as well?
Yes, sir.
Okay, good. Let's go ahead and I'm going to have you get up whichever way is easiest for you to get up. You turn sideways and then push yourself up with your arm. Yep, just like that. Perfect. Okay, let's have you stand up in front of that mirror. That was easier standing up, wasn't it? Did that feel easier getting up to you that time?
Yep.
Than the previous one? Good. Okay, let's have you close your eyes again, Benny, and flex your head forward and backwards again. I got you. Yep, good job. Boy, see how that evened that out down in your pelvis here? Let's pull these shoulders like this for me and just hold those there for me. I'm going to bring that head straight back now up here. I want you to shift your pelvis straight left for me. Yep, hold that right there. I'm going to feel a little tap there. Another little tap there. I'm going to get this right here. Okay, now you can relax everything. And let's have you flex your head forward and backwards again. And tell me if that hurts anywhere when you do that.
No.
Great. Okay, well walk around just a second here and I want you to tell me and everybody else how that feels compared to when you walk through these doors.
I just feel a little tingling.
Okay, in your left leg?
On my
Down your toe?
on my front top of my foot.
Foot, okay. How about the shooting pain down your leg right now?
Very little tingling.
Okay.
Nothing compared to before.
Okay, so you came in at an 8-9. What would you say it's at right now?
2.
2. Okay, that's good improvement. Okay.
I'm afraid to walk fast or anything.
Yeah, no, I want you to walk normal, heel toe, and let your arm
Right.
swing. Because I just put everything back in place and took the pinching off the nerves down in your sacroiliac joints and your sacrum. Now that don't mean you can go out and do cartwheels tonight, but that does mean that you can walk normally and start doing some easy stretches. And what I mean by stretches is that one little exercise I just showed you, this one. Head up, head all the way back, and then shift your pelvis straight to the left. That's your exercise for you right now. Just up, back, head back, and then shift your pelvis straight left. Yep.
Oh, straight.
Left, out to the side. Yep, just like that.
Okay.
Yep. So, being a first-time patient here and talking to our YouTube audience, how would you say this visit was compared to what you saw on the internet about me?
Very well. I would highly recommend it.
So did this take care of the pain for you more than what you thought it was going to?
Yes, I'm happy.
Okay, very good. Thank you for sharing your story with us.
Thank you.
Yes. And this is your Houston chiropractor, Dr. Gregory Johnson, and we'll see you next time.